Dr. Barry Bittman, and in this week's Practice Essentials, I'm going to focus on how to better care for patients utilizing volunteer health coaches. Just for a little background, more than a decade ago as a hospital executive, I was challenged with how to better serve numerous at-risk, needy patients in our community. The challenge was we couldn't afford the costs associated with hiring additional staff. Our team decided to train volunteer undergraduate health students, pre-meds, nursing, and counseling students to help care for our patients, particularly those with psychosocial determinants of health, such as poverty, food insecurity, or challenges associated with transportation, safe and adequate housing, and illiteracy. Fast forward several years, and our program successfully grew to include health coaches in several states. You're probably wondering how to begin this program in your practice. It's actually easier than you might imagine. First and foremost, college students everywhere are desperately searching for educational opportunities that provide real-world experiences. Consider contacting your local college or university, specifically those with pre-med or nursing programs. Begin with a few students and allow them to observe your staff caring for patients over the course of a month. Provide basic HIPAA training and set ground rules for weekly documentation and communications. When you consider them ready, assign a few patients who you believe would work well with a health coach. Provide a checklist of discussion topics, including pamphlets on healthy nutrition, exercise, and stress reduction activities, and ask each health coach to touch base by phone with the assigned patients each week. Be clear that health coaches must follow your recommendations and assign a member of your staff to follow up with them on a weekly basis. While I could go on and on about the benefits of this initiative, I'd rather share a story. Maria Gutierrez, not her real name, was a 78-year-old woman who had been seen in the ER 16 times in the last year. She had actually been admitted on 5 occasions for a variety of complaints. Her workups were essentially negative. One evening, her health coach came right to the point and asked why she frequented the hospital so often. She explained that during her marriage of 62 years, after each dinner, she would sit down on her sofa and knit while her husband would watch TV. She went on to explain that he had died 2 years ago. Maria added that each evening she would become both anxious and sad to no longer have her husband at her side. In a state of panic, she would call 911, and the rest was history. Our health coach offered to provide her cell phone number for Maria so she could call her instead of 911 whenever she became anxious. Not surprisingly, it worked, and over the next 2 years, Maria was seen in the ER only once for a minor laceration that required stitches. In retrospect, we never would have known how to help this patient without a dedicated health coach who uncovered the underlying issue. Today, many of our former health coaches are extraordinary physicians. This is your opportunity to do well by doing good. For more information, please don't hesitate to contact me or Sandy Lozo, RCMA Practice Support Liaison, at 951-686-3342, extension 318. Thank you.